a big question that many people have is how important is genetic testing for diagnosing early keratoconus? And in my experience, genetic testing can play a very important role for our patients that have early keratoconus, and in cases we're not quite sure, do they have keratoconus or do they not have keratoconus? The first challenge, though, is that it can be difficult to diagnose patients with keratoconus. Some patients with early keratoconus can actually have excellent best-corrected visual acuity, although they could have some irregularities on their corneal topography. And so it's our job as practitioners to identify patients that are at risk for keratoconus, perform vision testing, perform corneal topography testing, and for suspicious, try to figure out, do they have keratoconus or do they not have keratoconus? In these borderline cases, especially when they're early, there's a new test that's available called the Avellino test. That's a genetic test for keratoconus. And this test will help us understand if a patient has genes that put patients at higher risk for developing keratoconus. This genetic test will tell us if they have low-risk genes, moderate-risk genes, or even high-risk genes. And overall, it gives a good understanding of the patient's genetic composition to know whether this patient is at higher risk or at lower risk for developing keratoconus. And we can use all this information, the vision testing, the topography testing, and the genetic testing to best assess the patient and help guide them on what the next step should be for patients who may have keratoconus. So overall, I find that genetic testing, along with the other tests, can be quite helpful as we evaluate our patients for keratoconus.